So let me welcome all of you here today for this free webinar on prevention plus wellness. That's what PPW refers to, PPW Program Online Strategies Training. This is a 1-hour training session and it is being recorded, and I will send everyone who's registered today the link to this recorded training. So please feel free to share it widely within your and across your, among your colleagues and friends in your region and your state, particularly anyone who's implementing or planning on providing prevention plus wellness programs later this spring, this summer, in the fall. Do please share this, and I'll post this link on our website. We do have a link on our website. Website, by the way, is preventionpluswellness.com, and on that website we have a tools section, TOOLS, and if you point your cursor at the tools section, there'll be a drop-down menu, and the first item is COVID-19 resources. So under the resources, you'll see a link to this training when I post it later today. So, all right, so about an hour, I'll send everybody who's registered a certificate for 1 hour CEU. You can just type in your name, print out a copy for your records. And I'll send you the a PDF of the slides of today's training. And if there's anything else you need, just let me know. You could reach me at our website, preventionpluswellness.com, or you could email me at info@preventionpluswellness.com. And who am I? I'm Dr. Wirch, Chudley Wirch, president and founder at Prevention Plus Wellness, LLC, located here in beautiful Jacksonville, Florida. Thank you for joining us. I hope you're all well and safe. We are calling in from, we have a full webinar, and there continues to be interest in this topic. We've offered this webinar, I think, 4 times or more. And so if you need any help implementing your Prevention Plus Wellness programs online or remotely in any way, reach out to us. Contact me. I'm happy to help anyway. We do want you to continue to provide these essential evidence-based and evidence for informed prevention messages to youth and young adults, no matter what the situation. And in fact, especially because of the pandemic, young people need to hear from you. They need that connection. They need to hear this essential prevention message, and particularly the messages that we provide, which integrates the promotion of wellness with the avoidance of substance use. So let's take a look at, let me, first of all, before I do this, I'm going to enlarge the slides so that that'll be even a better view for everyone. There we go. And now let's go ahead and take a look at today's objectives. If I can get the slides to advance. Okay, all right, so here they are, 4 of them. The first is describe step-by-step methods for providing Prevention Plus Wellness as PPW programs live, online to youth, individually and in groups. Secondly, to list step-by-step methods for providing PPW programs by recorded video and telephone. Thirdly, to explore tools to monitor and evaluate online PPW program quality and effectiveness. And then lastly, number 4, the fourth objective for today's session is to identify a PPW program, online training and resources. So we're going to cover all of that. So quite a bit that we're covering today. And to start things out, let's begin with a poll to get a little interaction. So I'm going to pull up this poll. I'm going to launch it for you. It's just 3 questions. When you see it, sometimes it takes just a minute to show up for everyone. I think all 3 of these items, you could answer more than one response. So there's just 3 questions. When you see it, go ahead and answer as you choose. The first question is, how are you providing or planning on providing your prevention program? So this is a multiple choice item. you can answer more than one item. So wanting to know how you're providing or planning on providing your prevention programs. That's either now or in the future. And secondly, what do you need most to successfully provide prevention programs remotely? In other words, for example, online. And then you're going to scroll down to question 3. How are you or will you promote your prevention program? How are you or will you provide your prevention program remotely? And so those are all multiple choices. Let me just give you a couple more moments to finish that 3-question poll. People are quickly filling it out, and I don't want to stop until everyone's had a chance. We've got lots and lots of people voting. We're over 60% votes. Lots of people voting. We're up to 66% votes. Let's get 100%, everybody. Come on, complete your poll. It's only 3 questions. Love to hear from everybody. Oh my gosh, up to 70%. Can you believe that? Nobody reaches 70% in voting. That's crazy. That's like everybody should get a reward for that. 72%. Woo! We're breaking all kinds of records. 74% of you are voting today. Thank you for participating. Really appreciate it. And just about ready to shut off the voting. Up to 76%. Let's try to get up to 80%. Let's try to get up to 8 out of 10 of you voting today. Let's see if that's possible. Come on, I know you can do it. We're up to 77%, just 3 more percent to reach our goal of 8 out of 10 of you voting today. 77%. Can we get up to 80%? Hurry up, last few seconds. Whew. I don't think we're gonna make it, but we came close, 77%. Awesome, thank you guys for voting. Let me end the polling and let me share the results with everyone. So here it is, first question. How are you providing or planning on providing your prevention program? So we've got, let me scroll down the answer there. So most of you, the majority of you said live online. So 6 in 10 of you are doing it live online, but the next largest number are planning to do it with 47%, almost half of you doing some kind of recorded video. Love to know more about that. So maybe during our discussion at the end of today's session, we'll end up, with at least 10 minutes to talk, to discuss through the live chat. So love to know how you're planning to do that, that recorded video. And then a good number of people, almost 40% saying in person. I'm sure everybody's hoping and praying that we will be able to get back to some semblance of normality and provide our programs face-to-face with kids. But then also 29% said by telephone. So a large number of different ways of providing program, live online, as well as video and in person. Second question, what do you need most to successfully provide your prevention programs remotely? Training. So that's why we're providing this training today. I'm glad you think you need training. I'm glad you're here for the free training. And then for all of our live online program implementer training for our program, Prevention Plus Wellness Program, our 2-hour live training, we do emphasize and tailor that training to emphasize the approach that you'll be using to implement our program. So let's say you want to implement the evidence-based sport prevention plus wellness program to, let's say, high school kids. What we'll do is we'll focus that 2-hour training on that program, but also if you're going to implement it face-to-face, we'll focus on that. If you want to implement it live, we'll focus on that. So we'll tailor that training for you as program implementers and eventually as trainers too, on the approaches that you're going to use or may use to implement your Prevention Plus Wellness program. So we've got almost 80% of you saying training is what you need, and then also a rather large percentage, about half of that though, more than half, 44% said prevention programs. So all of our programs We now provide training. We also provide protocols to implement all Prevention Plus Wellness programs online. And those protocols are provided free and they're on our website. So if you implement our programs, we can give you training, including this free training. We can give you a program implementer training that is tailored to your needs for implementing our programs. And we also have our protocols for implementing all of our programs now live online, as well as by video and telephone. Some of you, 10% of you, saying other strategies. Love to hear what that is. If you have the live chat, type it in. I'd like to see what that is. What are those other online or remote strategies that you're using? I'm very intrigued by the fact that 10 of you are saying some other remote strategy. I'm wondering what that is. As far as training, I'd love to know more about what kind of training you need for implementing your Prevention Plus Wellness program. If this doesn't do it, if you need more, let me know. If you need some specialized prevention program, again, all of our Prevention Plus Wellness programs can be implemented online, can be adopted for that. If you need anything in relation to changes in our program, love to hear that. Always listening to our customers and potential customers, our providers and potential providers. Last question on the poll is, are you, or how are you, or will you provide your prevention program remotely? How are you? And of course, it looks like, once again, live online to groups of youth is the number one strategy. And that's followed by recorded video, and that's followed by, it looks like, a one-on-one. So there's, I didn't realize, but there's actually, you know, a good number, 31% of you are going to implement it one-on-one with you. So we have protocols for all of that, so we'll focus on that today, as well as telephone. And again, you've got 14% saying other. Love to know what that's about. Anyway, so thank you for participating in that, sharing that. That'll help me tailor today's training a little bit. So let's jump into it. So Prevention Plus Wellness programs have some built-in unique advantages that make them more feasible for implementation, whether that be face-to-face or online. And so let me just highlight these for those of you that may not be familiar with Prevention Plus Wellness programs. So they are, for the most part, single session program, and they come in either evidence-based or evidence-informed format. So you have a variety, but the fact that they're single session, you can really get a full public health effect by reaching all youth or young adults in your organization or your region or your state. They're scripted. That makes that increases the fidelity or the replicability or reliability of implementing them across time and across implementer. That cuts down on the amount of time for training. So there's some real advantages for scripting. You have options in most of our programs to provide them either to youth individually or in a group. And of course, now not just face-to-face, but also online. We have very brief, tailored, live online training if you want to be a program implementer. We also have online 2-hour training if you want to become a trainer. So the deal is here, you become trained as an implementer, you implement the program once, then you're eligible for that 2-hour live train the trainer as well. And then lastly, we do have optional pre-post program evaluation surveys, both in a scannable form as well as online form. So you can evaluate, even though our programs are evidence-based and evidence-informed, you can evaluate them for yourself to see how well they're doing with your population and your setting. Now let's take a look at the rank ordering of preferred ways to implement Prevention Plus Wellness program. First and foremost, if you can, obviously, I would think it'd be obvious that it would be to implement these programs, as well as any prevention program, or most of them, I should say, face-to-face. So either one-on-one or in a group, you face your youth, you face your young adult, that's ideal. But with the pandemic and other situations, you can't do this, so you go to the next level, and that is live online. I believe this is the next best thing because you still have that interaction learning. You still have audio-visual learning. So it's the next best thing to providing it face-to-face. So if you can't do face-to-face, live online. If you can't do live online, you could do recorded video. Now you have some options here with recorded video. By the way, recorded video does give youth the visual and auditory learning experience, but it's just not live, so you don't have that interaction. Now you have some options, as I said. We provide recorded videos of our programs. That's an option. Another option that I've learned about is how some of you are actually recording your lessons and then sending recordings of the lessons to your students. So there are some, maybe there's some other options. If there are, let me know. Send them to me in your live chat option here on your toolbar, and we could all learn from you. So when we go into our Q&A section, love to hear from you with regard to these things so that we could all learn from each other, share with each other, support each other. Really, really need that now more than ever. And not just supporting each other as professionals. If I could support you, it's my pleasure and honor to do so. You could support each other, and if you could continue to make contacts and support your youth, awesome. That's what we're all about here. Lastly, if you can't do those things, you know, that rural areas, poor internet connection, whatever the case might be, telephone is the next go-to strategy, sometimes correspondence, sometimes email. Love to know what you've got, but we'll be covering online video and telephone protocols for providing prevention plus wellness programs today. Now, the preferred way to implement PPW programs, first and foremost, is one-on-one, that is instructor and an individual youth, face-to-face. What does this protocol look like? You can see the 4 steps. First, and remember, our programs are scripted and they come with PowerPoint slides. So what you do is you first show your first program slide, the introductory slide, and you provide an introduction following the slide and following the scripted program manual. Secondly, you implement your screening survey to your individual youth or young adult. All PPW programs are screening and brief interventions. They include screening for health habits, feedback, and goal setting. So you know, just so that in case you're unaware, that you know where I'm coming from when the second step is you implement the screening survey to you. Thirdly, you provide feedback tailored to the screening survey responses to that youth, and you show your program slides. So there is individual tailoring to the current health habits of that young person when you provide prevention plus wellness programs to youth individually. This is this is the most tailored approach, very powerful strategy. It can be used for all youth as a universal prevention intervention or as a selective or indicated prevention program for higher risk youth. Lastly, the 4th step is you provide walk you through a goal plan and contract. You sign it, they sign it, you co-sign it. And those are the 4 easy steps for implementation, face-to-face, one-on-one. The 4 steps for implementing face-to-face in a group setting. This is, again, we're talking about implementing prevention plus wellness programs in a group setting, face-to-face. Same 4 steps. The first is you show your initial introductory program slide. You read the script for introduction. Secondly, you implement the screening survey to your group. Thirdly, you provide feedback, but it's a little less tailored because you're providing to the group instead of the individual youth. And then fourthly, you provide goal plan contract. They sign it, and then you co-sign it. So those are the 4 steps. By the way, the 3 steps. 4 steps and 3 components. Screen youth for the current health habits. This gets them thinking about increasing awareness of the range of their health behaviors, not just substance use, but protective wellness behaviors. Secondly, provide feedback about those behaviors designed to trigger future desired images of themselves, engage in the wellness behaviors, how substance use interferes with that. That increases motivation for change. And then you capitalize on that by having them do goal setting and contracting, which is to say to avoid substance use and to increase protective wellness behaviors. And that is all built into all prevention plus wellness programs. Very, very brief, powerful, motivational screening and brief interventions. All right, now let's go through the protocols. We're going to go through, first of all, let's say you're going to implement this to an individual youth online, live. Okay, I'm going to go through the steps. By the way, again, these protocols are are on our website, preventionpluswellness.com. They're available to anybody who wants to see them. And they're under the heading of tools, COVID-19 resources. But I'm going to walk you through them today. If you have questions, you could raise them in the live chat when we go to Q&A. And or you can send me an email anytime at info@preventionpluswellness.com. So let's say you decided you want to implement your Prevention Plus Wellness program to youth live online, one youth at a time. We're going to also go to a group implementation online, video, and telephone. So we're going to show you all these things today. So first step, you have a certain video conferencing platform you'll be using. Now, it's likely that you as an individual prevention specialist or health specialist aren't going to be making that decision. It's going to be made at a level above your pay grade by your organization, by your school system, or whatever the case might be. But the system could be Zoom, it could be GoToMeeting, it could be Google Classroom. For my wife, who's a special ed teacher here, has been for years in Jacksonville, Florida, Duval County, they're using a Microsoft platform. So anyway, you get this platform, and I say you select it, but really it's given to you in most cases. And the most important thing is that you become familiar with it. So it takes some time. Again, using my wife as an example, she's going on something like 6 weeks teaching online, supporting ESE kids. And so at first, very frustrating for her, a rather steep learning curve. She's wasn't familiar at all with that video conferencing platform, that Microsoft platform. And so a little bit frustrating at first, difficult to figure it out. But once she got the hang of it and learned and practiced, it's been a godsend in terms of her interacting, connecting, and teaching her learning disabled youth. So it's a good thing. The technology is a good thing, sort of a double-edged sword. Challenges to it in terms of learning, some limitations, but it can be a real benefit in times like this to keep you connected and to keep you providing those evidence-based messages and strategies like Prevention Plus Wellness programs to your youth. All right, so you have your video conferencing, number one. Number two, you send your youth, or somehow you communicate with your youth and let them know of a date and time of your session with them. If you're using these platforms, usually you'll send them a link to the session, so they have a set time and a date. If you're in a school setting, obviously you've got a classroom period, that kind of thing. So now you have an option under number two to send an optional pre-test link. So you can send them a link with instructions saying, go to this, click on it, complete this very brief, takes just a few minutes, pre-test, and then you could send them a link immediately after the lesson for post-test, and then you have access to those data to see how well your online training went. So the benefit, and there are some benefits to providing lessons, including PPW lessons online, is that you have this ability to have young people complete these pre and post-test surveys. We, as an organization, can give you a customized link so that just your organization will be able to use that. In other words, the other organization, your data will not be mixed with other organizations. So you'll be able to see how well you or your organization did with presenting a PPW program by having a customized organizational link to your pre and post test. All you have to do is ask me for it and I'll set it up for you. Any questions, you could just ask in the live chat later today. Step number three, you're going to ensure the setting is private for participants. So remember now, you're talking about their current health habits, including their alcohol use, or if you're using one of our other programs, vaping or marijuana or whatever. So it's got to be private. So try to get them in a private setting, but assume it's not private, just for just to protect them in that discussion, particularly when it comes to talking to that youth about their substance use. If someone is listening in, you do want to protect them and that communication between you and them online. So that's a little tricky, but I'll talk to you about that more. Step number 4, you're going to show the first program slide, and then you're going to read the scripted introduction. Step number 5, you're going to show the screening survey items, and these screening survey items are on the program slide. So we've made it easy for you. So the programs, the new PowerPoint slides for all PBW programs include the screening survey. You just show the slides, and then you're going to ask that youth to answer each one of those questions on a blank sheet of paper with a pen or pencil. So you could just say, hey, what you're going to need for today's session, a sheet of paper and a pen or pencil. So if they don't have it, you could wait until they get their hands on it, and then you could just continue at that point. Or you could tell them at the beginning of the session, or send an email saying, hey, listen, you need to have a sheet of paper and a pen or pencil. So we're in step 5. Again, you're going to show the screening survey items on the slides, and you're going to have youth answer each of the questions on a separate sheet of paper. You're going to ask each question again following the slides, and I'll show you how this works in the slides here in just a few minutes, and provide feedback tailored to each youth's responses. Remember, when you implement prevention plus wellness programs one-on-one, whether it be face-to-face or online, you're going to tailor it to how they answered each one of those screening survey questions. And you're going to have youth only respond using the letter response to the substance use item. I'm going to explain that later, but that helps protect the confidentiality of that youth in terms of how they responded. If they use alcohol, if they use e-cigarettes, if they use marijuana. So I'll show you how that works too. Now you have an option. I don't know how viable an option is. It depends on the video conferencing platform you have, but like Zoom, we actually have polling. You saw the polling today. So it's possible you could actually put your screening survey questions in a polling format and have them answer them. And then you can see how they answered, and you could tailor the responses accordingly. So, but it may be a little bit too unwieldy. It's something that you could look into, test it out. Like all of this, you're going to need to get comfortable with this video conferencing platform. So you've got 2 challenges as a prevention specialist or a health specialist now. In the past, it was just learning the Prevention Plus Wellness program, scripts, and practicing them and learning how to provide them to youth individually or in a group. But now, in addition to that, you have to learn how to do that on this new technological platform. So you have 2 things to learn, and you have to work them together. You have to be able to show your program slides. You have to be able to interact with your youth. If you're implementing to one youth, then you're going to want to open up your platform like we have it here. You could see me. But if you're presenting this to one youth, you'd really want to see them if they have the video option on their device, so that you are literally, it's just like being together. It's just like being in person. You could see them, they could see you. If you have just one or a handful of youth, that's ideal. It depends on the video conferencing option you have and whether your young people have the technology and have the video camera built in. If not, then certainly you want at least to have verbal communication, audio both ways, so they could hear you and you could hear them respond. So you're having a conversation. So it's like a telephone conversation, but it's more than that because they could see you, which really makes a big difference. Even if you can't see them, they could see you, and so that makes a significant difference in impact and quality, I think, in the instruction and the communication. So small group, 1 person, 2, 3, 4, 5, 6, whatever, you could decide. You want to have the video if possible, but you certainly want to have the audio so that when you have interaction, when you have questions, they could answer. If they cannot answer, if they don't have a built-in microphone, or if you have a larger group, let's say 20, 30, regular classroom, then you're going to probably want to rely on the chat. Most of these platforms, if not all of them, have some kind of a Q&A or live chat option. And so you could ask questions, have them find the chat link, click on it, and type in a very brief answer. So a couple of words or a very brief sentence, so that there's that communication back and forth. So they can see how it requires that you have some practice, not just in the program, not just in the Prevention Plus Wellness program and the script and how to implement it with the slides, but also how to do that within this online platform to that individual youth. And so start slow, practice, enjoy it, test it out, try it with, you know, your colleagues, try it with a single youth a couple of times, till you build up some confidence and comfort level and know how to fully utilize the video conferencing platform to your benefit, to your advantage. Okay, so, and by the way, I would say that there's a lot of free training available on all these platforms. If you go to Zoom, they have recordings and they have free webinars and so on. You could just take those and you'll get comfortable and up to speed very quickly. Let's see, that's step 6. Step 7 is when asking youth a discussion question, have them respond verbally or by live chat. I've already mentioned that verbally is preferred because you can hear each other. But that's going to depend again on whether they have a built-in microphone and so forth. So, and again, if it's just one youth, I mean, you really want them to have the verbal and the audio, the picture on if possible. If not, you could always use the live chat. Step 8, you're going to read and show the online goal plan. After the PowerPoint slides, you're going to read and show the online goal plan contract or the original hard copy version, and you're going to help you complete it on a blank sheet of paper. So you're going to show the PowerPoint slides, which show the new online version of the goal plan, or you can pull up a PDF and show the original version in your program manual. Go through each part of the goal plan, and you're going to have your individual youth complete that goal plan again on a blank sheet of paper. So they need a blank sheet of paper and a pen or pencil to fill out the screening survey, which is a part of the intervention, and the goal plan, which is a part of the intervention. Okay? Then step number 9 is you can send them a customized link to the online goal plan if you want them to complete the goal plan a second time online. The advantage of this is that it's just a good reinforcer. Secondly, they can do it online and they can print out a hard copy. Thirdly, I could give you a customized link to the goal plan so that you can see how your group of students are completing the goal plan. You can get that feedback. You could monitor how the goal plan process is going. Okay, and then, or you could send them, you know, or mail them or email them a hard copy of a goal plan. So you have some options with the goal plan. Step number 10, you could send them an optional link to the post-test. So remember the pre-test, post-test, it's an online link. We can customize it for your organization. This is optional, but it's a great opportunity. It only takes a few minutes. And for you to monitor the quality and the effects of your lesson to youth, it's great. You don't have to collect the data. The students go to the link, they enter it. It's a beautiful thing because you don't have to collect the data on a blank sheet of paper and enter it. You don't even have to scan it in the scannable forms. They fill it out and you have it. It's awesome. So really consider doing the pre-post testing using the customized links. And lastly, you could, the implementer, complete an online or a hard copy of the instructor survey, which is a process measure in all of our programs. So that's one-on-one if you implement your program live online one-on-one. If you implement it online to a group, now this group depends. It could be different sizes. It could be a typical classroom size, which would be rather large, 20, 30 students, or it could be a smaller group, any for 2, 3, 4, 5, 6. I mean, there's a difference there. If it's a small group, again, you really want to try to use your video and audio so that you have really like an actual face-to-face meeting with that small group. If it ends up being a larger group of, again, 20 or 30, you may, having the audio on could be problematic, although you could teach them to mute the audio on their end and only unmute it so that there's no background noise. See, these are all things that you could learn when you, practice hosting. You may not have hosted yet. You may have participated in lots of webinars, lots of online trainings, but until you host and have access to your toolbar and play with it a little bit, it does take a little bit of practice. Trust me. And so the steps are basically the same. The only difference here when you implement, step number 1 is the same. You have to be comfortable and practice your conferencing software. Step number 2, you're going to send your group, in this case, not just an individual youth, but your group, the date and time for your, and maybe even a link to log into the session. And if you want, an optional pretest link and instructions to have them fill it out before tomorrow's or next week's session. Step number 3, you're going to show the first program slide and read the introduction. Step number 4, you're going to walk them through the screening survey on your PowerPoint slides, have them each answer on a blank sheet of paper. You're going to have them go through that process, not just thinking, but also writing their answers so that they can really make sure that you have them respond. And then when you ask those questions again, when those questions come up again in the PowerPoint slides, you're going to have them answer only to themselves. I'll show you why in a minute. You have your option to do a polling. If you want to do the whole group, have them complete their screening survey in a poll, but you don't want to show them the poll response. I'll show you why in a minute. Step number 6 is when asking youth a question, you're going to have them answer. Again, if it's a small group, you could have them take turns and answer verbally. If it's a larger group, you're going to have to limit it to the live chat. But you'll be able to pull up the chat, everybody can see, so you can have that interaction. And you do want to have interaction when you're presenting your Prevention Plus Wellness program online. That's the advantage of doing it online. You want to bring them in and include them in the process. Step number 7, read and show the online goal plan. Or you can pull up the original hard copy of the goal plan, have them completed on a blank sheet of paper, send them the link if you want to have them completed again online, optional post-test link if you want, and then your instructors can complete that instructor survey process evaluation. So those are the steps. That's the protocol for implementing your Prevention Plus Wellness program online live to an individual youth or to a group of youth. So let me walk you through this to show you how this works. So let's say that we're implementing the Sport Prevention Plus Wellness program, the high school version. And so let's say we'll go back and forth here as to whether we're implementing it to one youth live online or to a group of youth. So you show that slide, that's the introductory slide. You read your introduction in your script. The next slide is asking them to complete the health and fitness screen. And so you're going to say, hey, you need to have a sheet of paper, pencil, a pen. You need me to wait a minute. We grab that. Good. Everybody's got it ready to go. And then your slides will show the screening survey questions. And you're going to go through this with them, read each one if you want, have them read it if you want to have them engage, but write their answers. So the first question is, you know, have what sports or physical activities did they play last year? And say, well, if you played baseball or softball, under question number 1, put a 1 down on a sheet of paper, write baseball or softball if you did that last year. So have them interact that way, have them write their responses. There's more items for number 1. For these other items, they just put the question number 3 and they write the answer yes or no. So they're engaged in that process. And notice it's very short, only 6 questions or 5 questions or 7 questions, depending on which Prevention Plus Wellness program you have. So that's the screening survey questions. And then that first survey, the first screening question is restated in the slide What sports or physical activities did you play last year? So this is where you could pause and you could have some discussion. You could actually have, if you're implementing this to this one youth, you want to know how they answer that, because if they say yes, you're going to provide a response to the yes. If they say no, you're going to provide a different response to the no, because that's how your individual script works. If you are presenting this to the entire group, you could just have them have a discussion or a chat. They could answer what kinds of things, that sports, physical activities they've played, so that you could have that kind of interaction for the group. After that, you provide your PowerPoint images that promote and cue desired future images of young people of themselves in the future, being more fit and active, very motivational, very powerful. You're going to link how alcohol and drug use interferes with those benefits and images and that healthy behavior. There's a restatement of the second screening survey question. Now, from here on in, let me just clarify something for you. When you implement this one-on-one, live online or in person for that matter, when you implement this one-on-one, you're going to want that youth to answer so that you can provide the tailored feedback. When you present this in a group, that means 2 or more, what you want them to do is answer to themselves. Okay? Why? Why don't you want them to answer but the hands raised or verbally or live chat? Because it's likely that the majority of youth are not doing the healthy thing. In other words, for this question, for example, do you participate in physical activity 30 minutes 4 or 5 times a week? It's likely, based on national youth risk behavior data, that the majority of youth are not getting regular physical activity. The majority are not eating breakfast. They're not eating many fruits and vegetables. They're not getting 8 or more hours of sleep. So you don't want, if you have a group, you don't want to show get that feedback, because otherwise you're going to be projecting and communicating a negative norm. You don't want that. It's just going to support, you understand where I'm coming from? It's going to support the negative behaviors, the lack of wellness, the lack of healthy habits. So you don't want them to respond. That's why when you do a polling for a group, if you do the polling, you don't want to show the polling responses. You don't want to show that most youth in the group are not getting regular 8 hours of sleep. That's not the kind of a norm message you want. Again, you show your slides. Here's where we've built in discussion or reflection questions. And this is a great place to stop and have interaction, either with your individual youth or with your group, but particularly with your group. What types of sports or other physical activities would you like to try or do more of? So here you can have some verbal feedback, some live chat responses, and get them and keep them engaged. So we built these discussion questions into our new Prevention Plus Wellness slides. And then toward the end, you'll have recommendations for increasing wellness, not just avoiding substance use, but also engaging in each one of the protective behaviors. And you're cued now to complete the goal plan. Now you have an option here. You can follow this, continue showing slides, which will show the online goal plan, which is fine. They can complete it in a blank sheet of paper, and then you can send them a link to complete it a second time online. Or you can show your PDF of the hard copy of the original goal plan in your manual. Again, same thing, you're going to want them to complete it on a blank sheet of paper. And then at that point, if you want to send them a hard copy, or you want to send them a hard copy in advance, you can do this. We cover more of this when we have the 2 hours live training for program implementers. So your online goal plan contract, there's a link to it there if you want to take a look at it. We could send you a customized link just for your organization if you want to have take a look at how your youth complete the goal plan. And the measures include, there's a couple of measures of demographics, age, and gender. Then there's having youth pledge to avoid alcohol and drug use over the next 7 days. Then they identify measurable, healthy habits to improve. They identify who's going to co-sign their contract, what specific location for posting their goals so they can monitor them every day. Some feedback is provided on what they provide feedback, I should say, on what they liked and didn't like about the PPW lesson. This is great evaluation, subjective, I should say qualitative evaluation data for your benefit. What they like best, you can use to promote your program. What they like least will give you ideas on how to improve your program. And then they also have a chance to rate the goal plan. All of this is on the hard copy. I should say all of this is on the link to the online goal plan contract. Okay, let me know if you have any questions about that. There's also, as I mentioned earlier, optional online pre-test and post-test surveys. We can again provide you with customized links just for your organization so that just your youth data will be grouped. These surveys measure 2 key indicators or predictors of substance use and healthy behaviors: behavioral intention, the most highly predictive measure of future behaviors, and perceived harmfulness. It includes measures of 5 substance use behaviors: alcohol, tobacco, e-cigarettes, marijuana, and other drug use. 4 wellness behaviors, including physical activity, nutrition, sleep, and stress control. And there's a link, and you could go see one of these. I think it's the pretest we're showing there. Again, we could send you a customized link if you're using our programs so that you can evaluate your online prevention plus wellness program. So I'll be sending you again a PDF of these slides so you can actually click on them. Let's see, we can also put the online instructor survey, the instructor survey online, but you also have hard copies of the instructor survey. Every instructor should complete the self-assessment tool called instructor survey. It assesses 7 really critical implementation elements, from number 1, level of comfort and active presenting style, to number 6, content completion and use responsiveness. So great tool to assess the quality of your program implementation. I'm going to stop at this point and say, now those are the protocols for implementing online, live to youth, either individually or in a group. Now, if you implement a recorded protocol, a recorded video, I should say, whether you record yourself and you send out the link, or whether you order up one of our programs on video and send it out, really, this becomes much simpler. Essentially, it's step number 1. If you want to send them a customized optional pretest link, you do that. If not, you go to step number 2, which is you send the youth a link to the recorded video. And if you want, it could also include a link to the customized online goal plan. And that's it. And then step number 3 is if you want to have an optional post test. So really, the video is very efficient, but the problem with it is it's not live, and so you don't have the interaction. So just keep that in mind. You're gaining something in terms of efficiency and less effort on your part as a prevention specialist once you have your recording, whether you made it or you use one of ours, but you lose the ability to monitor the youth. That's why I think it's really important. If you're going to use a video, you do want to send them a link to the online goal plan to see that they're at least following up with that. Otherwise, if you send them a link to a video, you don't know if they viewed it, or to what extent they viewed it, or they watched it, or they just turned it on, or somebody else turned it on. So unless there's some monitoring, whether through a goal plan or maybe some kind of a testing process, you don't know whether they've really viewed that video. So keep that in mind. So there's some advantages and disadvantages of the video. And then also we have this protocol on our website, how to provide your prevention plus wellness program by telephone. Obviously, the The good news about the telephone is you hear them, they hear you, you have that communication. It's better than just an email, but they don't have the visual. For the visual learner, they don't have something to see. So you can address that in a couple of ways. So if you scroll down, use your eyeballs, go down to number 6, you could mail or email a completed and co-signed goal plan before the lesson. And then option number 7 is you can mail, email, or text a copy of the slides and the goal plan and even the screening survey before your phone call. So if you do some work beforehand, you could send your youth the screening survey questions, the PowerPoint slides, the goal plan, and then when you call them up on the phone, you could have them look at these documents and have them, you know, there's something for them to look at as you speak with them. So you can improve the quality of the phone protocol with a little bit of extra effort by getting these materials, screening survey, even the slides, and the goal plan in advance of the telephone call. Now, as far as slides go, you may want to put maybe like 4 of them in a page, black and white, to save you some cost rather than, you know, a full, you know, color single page slide. That could be very expensive. So again, we can help you with this if you have questions. And when we do training, program implementer training, we cover this a little bit more in depth. We do have a video clip, and you can request an entire Sport Prevention Plus Wellness high school program in a video format if you want to review it. It's essentially the slide program with audio and some transitions between slides and some background music. So, but you could take a look at it and see if that's something that you'd like to use, purchase that for your use in addition or separate from you implementing your program live. So we have a number of resources. We have this training, which is recorded, and we'll put the link on our website under the heading of preventionpluswellness.com, tools, COVID resources. But we have our remote protocols, these things that I've just showed you, protocols for implementation live, online with one person, with a group, by video, telephone, all of those step-by-step protocols are on our website. We do have the videos for $4.99. We do have online program implementer training for $1.99 per instructor, train your trainer for $3.49, programs updated for use, not just in person, but online, $4.99 per instructor. And then we have the free COVID resources. So if you need anything, if you have any questions, you could always reach us at the preventionpluswellness.com or info@preventionpluswellness, or that's our phone number there in Jacksonville, Florida, 904-472-5022. As I said, I'll send you a PDF of these slides so you'll have this information. If you go to our website and put your email in, you'll get regular weekly email blasts to keep up to date with all of our free resources, webinars, and then also our updates with our evidence-based and evidence-informed programs. There's a latest snapshot of our homepage. Notice we're emphasizing COVID-19 solutions. It's not that we prefer you to implement the programs online or remotely, but that we have given you the tools to do so you can continue to provide your programs regardless of the pandemic. And that's what's so critical, that the youth continue to get these essential screening and brief interventions that are so important to get them to think about their health habits, to motivate them to change their behaviors, not just substance use, but the protective wellness behaviors, and they get them to act on that, and they increase their self-regulation skills to set and monitor goals, to start that process of behavior change, to improve their lifestyle. It's a great tool, Prevention Plus Wellness programs, and you can provide them live online. I'm going to stop at this point. And now's a chance for us to take a look at what kinds of questions you might have in the live chat. So find your live chat, click on it, ask me anything you want, make any comments you want, share anything you want with others. Remember, it's not just you and me, it's everybody else who's online from throughout the country for today's session. Anything as long as it's related to the topic. So let's go back to the beginning and see what things we've had stated. I'm going to go back and then we'll go in order of their typed in. I could hear, I could see. So a lot of that was just the beginning. Pamela's can hear, can see. While I'm going through this, if you have questions, feel free to ask them at this point. Can hear, see. Okay, will your PowerPoint be available after the webinar? Yes, I'm sending you a link to the recorded session. I'm going to send you a PDF of the slides that you viewed today. So, and then again, remember on our website, preventionpluswellness.com, under the heading of tools, there is a COVID resources page. Everything and more that we discussed is on that page. So you can look it over. And if it helps, good. If it doesn't, if you need something else, if you need something else in training, if you need something else in materials related to the programs that we provide, let me know now. You've got the live chat. You're in control. Send me a note right now. Let me know what you need, how I can help you, what we can develop, what we can provide you. And we're happy to, I'm listening to see what we can do to support you in any way, to provide your programs during the pandemic and beyond. Great question that was, has this program ever been offered in a peer-to-peer model? Yeah, great question, and the answer is yes. We have, in fact, on our website, you'll see under the training, we have youth leadership training. We can train youth, or we could train you as a trainer, and then you could train youth to turn around and provide this single session, evidence-based or evidence-informed program to their same age or younger age peers. So definitely that's an option, a very powerful option, because young people, now I could just tell you in our experience, that means that either, you know, most organizations will have leadership groups or youth groups, and this is a great tool and experience for them. Practical, hands-on, they learn about evidence-based programs, they learn about prevention and wellness, and then they learn about, and they could take the script and they could go into a group and they could present this. It's an amazingly powerful experience for them. It's great to have the messages come rather than from me or sometimes even from you, but from their peers. And so some of you I know are out there working on how do we get our peers to provide the, let's say the sport PPW program or vaping PPW program. How do we do that? Get the peers to provide that to their youth online. That's new. So if you're interested in that, exploring that and how we can help support that, love to do it, because that's really new. In the past, what we've done is we've trained youth, or we've trained providers to train youth, and then their youth will go usually into a classroom and present it, and present the group script of one of the Prevention Plus Wellness programs to their, you know, show the slides, read the script. It's all laid out. It's very doable for peers to provide this program. So great question, great. And this could be for high achieving youth, for all youth, for high risk youth. Very powerful, because they received the program and then they have to turn around and be a good role model. So excellent question. Thank you for that. Great job. Thank you very much. Are the PPW programs designed for schools only? No. In fact, they're implemented in any setting where youth are. A lot of boys and girls clubs, YMCAs, juvenile justice, sports, recreation, after school. What am I missing? At home. So lots of, wherever you can find youth, you can provide it. It's a single session. The sport PPW program includes parent materials. So that gets parents involved. So lots of opportunity. You could implement this with other evidence-based and non-evidence-based programs, and that way, or you can implement it alone. But because it's a single session, you can get a full public health effect. By that, I mean, you know, rather than having, let's say, a multi-session program or a more intensive program that is 6 sessions or 8 or 10, 12, 15, and then you get a certain percentage of youth in your community or your organization, your school, 20%, 30%, let's say you get 50%. With a single session prevention plus wellness program, it's conceivable you can get 100%. And that means you could really, even with a small effect size, you're likely to have a large public health effect because you're reaching so many youth. So think of it like a vaccine. Everybody gets a vaccine. That's really a public health effect. Everybody gets a screening and brief intervention. That makes it really a significant influence on improving and protecting the health and well-being of youth and young adults in your community. So great question there. So thank you for that question about schools. We are looking for software that is a video format that we can collect pre-test and post-test data from within. We're also interested in your services and have already started implementing 2 evidence-based programs online, 1 training and 1 education video targeting parents, all with Amazon gift card incentives. I love it. I really want to talk to you. Who is this? Susan, really, let's talk. So we could, I could see if I could help you in some way, and I could also learn what you're doing. But it sounds like there's a lot of good things you're testing out there and for others to think about. So, but you're looking for a software that is a video format that you can collect pre-test and post-test data. So we've got the pre-test and post-test online. There are links. You could, it's possible that you can put those links in the PowerPoint slides within your video. So so that's a possibility. I'm not sure that that's getting at what you're thinking of, but let's talk, Susan. Let me know when you have a chance. And not just for you, but for everybody here, if you want to reach me, here's my phone number, 472-904-472, and it's 5022. So that's my phone number. And again, my email is simply info@preventionpluswellness.com. So if you don't mind reaching out to me, and then we could, you know, or let me know, shoot me an email when you would like to chat. I'd love to learn as to what you're doing. If I could help in any way, I'd love to. So it sounds very, very intriguing, Susan. I'm not sure I'm capturing everything with that, with the live chat. So this is where the live chat obviously breaks down. It's sort of like a text. You can only communicate so much and so well with the text. You do need to have other types of communication. Also, what do you say to schools to get them to participate? Great question. So the beauty of the advantages of prevention plus wellness programs are, number one, they're brief. That opens the doors to schools that say, oh, I can't afford to do a prevention that's 6 or 8 or 12, 15 sessions. 2, it addresses not just substance use prevention, but physical inactivity or obesity, poor nutrition, lack of sleep. It really is broad and positive, and schools and parents love that approach, and their kids need it. They need it. So so my point is that it's an easier sell than a typical risk-based substance use prevention program. But also on our website, preventionpluswellness.com. Sorry about having to say this often, but if you go to it and look under tools, you'll find something called a PPW program menu, I think it is. And that's a tool that you can take to your school administrators, your Boys and Girls Club administrators, any organization you're trying to get into, and you walk them through this menu survey, and it gives the administrator, the decision maker, options to choose how you could provide the program, lots of options, lots of different things to address, and gets them to think about how it could best fit into their setting and how they want to tailor it. So it's a great, great tool. We developed it just for your purposes. It's under the heading of tools. I think it's called PPW Program Menu or PPW Menu. Look at that. That'll give you some ideas, but you can send me an email if you want to set up a time to chat a little bit about that. So that's what I would say to schools or any organization you're trying to get access to, because definitely that becomes an issue. You have to get access to an organization. You have to get access to the kids to make an impact. Do you know if anyone has done this in a day camp style along with other wellness? Yes, they have. They've done it in day camps and camps out into the woods and all different types of summer activities, summer sessions, and you build it in very easily. So it's a single session, but you could expand it. If you have the camp, it's very easy, like after school and so on, you have access to the kids in our online, in our 2-hour live training. We will show you how to expand it beyond a single session. If you want to have a 2, 3, 4, 6, 8 sessions, we will show you and give you some extra content and tools to expand it. For example, you can just do extra sessions with youth following up with the self-regulation skills of setting and achieving and monitoring their goals, the behavioral goals. So that's just one idea, but we have a lot of web-based resources and other things I will share with you during the program implemented training. Is there an opportunity to receive the webinar certificate even if the Zoom meeting has reached maximum capacity? I don't believe that's the case today. It hasn't. You're talking about whether it's live or not. Send me a note about that, Ashley. Let me know what you're thinking of. I can see if we could figure something out. But yeah, you've got the recorded session. I'm sure we could work out something. Send me a note so I know what you're looking at, what you're interested in, and if I can help, I'm happy to do it. So those are all excellent questions. Any other questions, any other comments? I think we ran a little bit longer, but I'm fine. I'm happy to stay here as long as you want. Anything else you want to ask me? If you want a sample of any of our Prevention Plus Wellness programs, you can request that from me. You can go to our website. The easiest way to do that, go to our website, preventionpluswellness.com. And there'll be a link there for requesting a sample. I think under programs, request a sample. We'll send you a redacted sample of any of our programs, our evidence-based programs, sport or in-shape prevention plus wellness, or evidence-informed vaping, marijuana, opioid, in God's image, our faith-based program. Just let us know. Happy to share with you what we're doing. And do let me know what you need in terms of online or programming tools or training so that you can reach out and give this essential prevention message to your youth during the pandemic. So God bless you for what you do. You're making a difference in the lives of youth and families. It's critical you continue to do what you're doing. Please let me know if we can do anything to give you a hand or help you in any way. I would love to do it. It's my honor and pleasure to do that. And thank you for joining us. Have a great day today. Stay safe. Take care of yourselves. Take care of your family and your kids. And thank you so much for joining us today. Bye-bye, everybody.